Hi Holistretch fam, welcome to a Holistretch video. My name is Frances Eve. In this video, I will be showing you how to stretch your clients' quads and hip flexors. So go ahead and follow along with a friend, and if you like this video, subscribe below and I will see you right in there. All right, welcome back. So what we're going to do is have your client on the table. You can do this on the ground, but it's a bit more challenging with your body mechanics. So I recommend having a table. But what you want to do is just kind of loosen up their hip joint. So we're grabbing the knee, the ankle, and the foot and just sort of moving the leg as it naturally would. So if you feel any blocks because they're stiff in a certain area, don't push it, just notice it. Okay, then we're gonna rest the foot down and bring your hands to the top of their knee. So it's a little bit towards their hip, but we're pulling using the length of our body. So as you lengthen up through your spine, you're pressing the knee back towards you. And what this is doing is decompressing that hip. So now the thigh is being stretched, these psoas muscles are being stretched. And this is a nice way to just loosen up the body in preparation for the rest of the stretches. See if you notice any difference in here. I like to move the leg around quite often just to notice where else it's tight or if we've opened up any areas of tension. And then we'll move on to the other side. So loosening up that hip joint. This leg felt a bit looser. As you can see, it has a bit more range of motion. Now we're going to bring the foot down and do the same thing on this side. So lengthening up through your spine to pull back and using your body weight to pull back. And you'll feel a nice natural tug of the hip as the psoas opens up and stretches, releases. And you can give it like a gentle wiggle too. Nice. Seeing if you've opened up any areas of that leg. Good. Next, you'll have your client lay on their side. It doesn't matter which side you start with, any side is fine, but you're gonna go ahead and grab their ankle and then with their other hand, grab onto the top of their knee. You wanna be mindful of the knee joint here. It can be a little fragile in some people, so be mindful. Don't pull too hard. Now the line of fascia here is the top of the left quad. It goes all the way to the right side of the upper torso. So in order to create this length, you want to have them pull their torso a little bit towards the front instead of getting pulled back. So as we're pulling the knee back, we're asking them to bring the knee forward. This is creating some resistance. And this is a real deep opener for the hip flexor and the psoas here on the left side. So he's pulling forward and then I'm pulling it back. So there's a little bit of a seesaw motion. He's pulling forward and then I'm pulling back. So he lets go a little bit and vice versa. We're gonna have your client now just drop that top leg down to the ground. And I apologize for not filming the foot, but basically their foot's just on the floor and your foot is just helping them not slip. All right, we're going to go ahead and grab their back ankle, and this is opening up the hip flexor in a different way. So now we're opening up the quad. Okay, so how we do this is just allowing their knee to bend until they feel a stretch. So ask them when they feel a deep stretch and they'll let you know. And when they do, you can gently push in and allow them to push back by slowly kicking up into your hand. Okay, that's creating some resistance here and opening up the tissues in the quad. While you're offering them this amazing assisted quad stretch, you can gently massage their hamstring or their gluteus. Compressions are really nice. You might notice areas of tension and tightness in their hamstrings or knots in their hamstrings. And we will end this side on with a spinal twist. So having them bend their front knee all the way up towards their chest, you're going to bring one of your hands to their mid-back and your other hand to the pectoral muscle on the left side or whatever side they're twisting, and let their spine twist. Oftentimes you'll create pops and cracks in their spine, and this is a really nice way to just open up nice and wide. Good. Now you'll have your client lay on their other side, and we're going to work on that hip flexor opener again on this side. So remember, grabbing that top leg and the knee, we're going to draw it back towards you and make sure that they're pressing their torso forward. This will allow a deeper stretch in the quad, the psoas on that side, and have them breathe, of course, creating that resistance as they come forward, and then you pull back. Inhaling forward and exhaling back, creating that even pulling and pushing. That's right. Now we're going to go ahead and have them switch down to bring their leg on the floor on the other side, and stretching that quad. You can bring your knee as a little bit extra weight if you want. I like to do that sometimes. And then bringing either the elbow or the hand to palpate the glute and the hamstring, and even around the IT band in this position. Make sure you don't press too hard. Keep in communication with your client. Have them kick into you for resistance to create a deeper stretch. And you can also use the ankle to create angles. If you notice there's knots more in the adductors or the abductors, you can just rotate that leg. Very good. Now we're going to switch over to the spinal twist. So having them bend their knee in towards their chest, you can bring your knee in towards their navel and then the hand on their mid-back. Have them take an inhale and then exhale, looking over their opposite shoulder if they can. And some deep breaths in here. This helps open up that whole spine. And it's just a nice way to end your practice. Thank you guys so much for joining me. I hope that these exercises and stretches helped you out. If there's anything you'd like to learn, please leave a comment below and subscribe if you haven't. Thank you guys so much. Have a wonderful day.